Hello, I'm Audrey Dunn, and this is my English 112 multimodal presentation, The Dangers of High Nurse-to-Patient Ratios. High nurse-to-patient ratios pose a significant threat to patient and nurse well-being. While poor nurse staffing existed long before the COVID-19 outbreak, the issue was only exacerbated by the unprecedented pandemic conditions. Research has indicated a link between these high ratios and an increase in negative patient outcomes. Moreover, high nurse-to-patient ratios have been found to increase nurse burnout and turnover, simultaneously raising hospital costs through increased errors and extended stays. This presentation will inform individuals about the specific dangers of these high ratios to nurses, patients, and hospitals. Nurse-to-patient ratios refer to the number of patients assigned to a single nurse. These ratios are dependent on a variety of factors, including the nursing department, general patient acuity, and the overall staffing environment. As staffing is partially determined by patient acuity, which is the intensity of nursing care a patient requires, nursing departments such as the intensive care unit will generally have lower ratios than those such as the psychiatric ward. However, few states have legislation supporting safe nurse staffing. California is the only state to pass legislation defining staffing ratios by individual hospital unit. However, Massachusetts state law limits nurses to one patient in the ICU. Other states have attempted to tackle this issue through public reporting systems and hospital-based staffing committees with varying degrees of success. High nurse-to-patient ratios pose a significant patient safety concern. With each additional patient added to a nurse's average workload, the risk of patient mortality increases by as much as 13%. Poor nurse staffing has also been linked to other adverse patient outcomes such as pneumonia, sepsis, failure to rescue, pressure ulcers, and hospital-acquired infections. When nurses have high patient loads, they are unable to provide patients with the level of care they deserve, which can lead to medication errors and missed symptoms. Such events have the potential to prolong hospital stays and worsen a patient's overall condition. This has also been linked to increased rates of patient falls. Dr. Linda Aiken, a leading nurse staffing researcher, found that within a 2-year period, the use of safe staffing practices in New York hospitals would prevent an estimated 4,370 patient deaths. Additionally, high nurse-to-patient ratios exacerbate nurse burnout, thus increasing nurse turnover rates. In a study of New York nurses, Aiken found that during the COVID-19 pandemic, rates of burnout among ICU nurses rose from 47% to 62%. She explained that these numbers are similar to those of the critically ill patients they are treating. In a 2021 study, almost 2/3 of nurses suffering burnout reported inadequate staffing as a reason they left their jobs. High nurse-to-patient ratios are also thought to increase the risk of occupational illness and injury among nurses. When nurses are assigned high patient loads, they are forced to work in a time-pressured manner. This can lead to a higher risk of needle stick injuries and contribute to back and shoulder injuries when nurses are forced to move patients themselves due to a lack of available assistance. One study found a 32% reduction in illness and injury among registered nurses after the implementation of California's safe staffing law due to the increased staffing levels. Adverse patient outcomes resulting from high nurse-to-patient ratios pose a significant cost to hospitals as well. Hospitals are penalized from Medicare for these issues as they are not reimbursed for the patient's extended hospital stay. Aiken found that New York hospitals would save $720 million over a 2-year period due to reduced patient stays and better quality of care. It is also costly to replace nurses who leave due to burnout from high nurse-to-patient ratios, as the cost to replace a single registered nurse is estimated to be upwards of $50,000. When nurses leave due to poor funding, it also places an additional burden on the remaining nurses, which leads to further burnout and increased turnover, which necessitates the costly replacement of even more staff. High nurse-to-patient ratios threaten the well-being of both patients and nurses. While the dangers of these high ratios are clear, states and hospitals are slow to act. This has resulted in tragic, preventable patient death and suffering. Additionally, it has taken a physical and mental toll on nurses, driving many away from the profession. The data is undeniable. Poor nurse staffing is deadly. The nurse staffing crisis will not be an easy problem to solve. However, California has found success with their nurse staffing legislation. Hospitals and states alike might take inspiration from these guidelines to improve healthcare in their communities. These are my sources. Thank you.